Dr. Jay Shah estará conosco no 17º CBDOR com um workshop pré-congresso sobre o assunto pontos gatilhos miofaciais e sensibilização central na dor crônica, agulhamento seco e técnicas de estimulação elétrica. Welcome, Dr. Jay.
It's a pleasure to be with you. Thank you so much for inviting me, Lucy. First of all, I want to say I'm so excited to return to Brazil and to teach a workshop, an all-day workshop, and I invite all clinicians to come and join us, whether you're physios, dentists, doctors, acupuncturists, all are welcome. Let me give you a summary of what I'll be talking about in the workshop, and that is the importance of identifying myofascial trigger points. So when you press on an active trigger point, you reproduce the patient's pain, yes? And we have done microdialysis studies which have shown that these active trigger points have elevated levels of a number of important biochemicals that can directly activate and sensitize the local nociceptive ending, sending increased bombardment into the spinal cord. Before the spinal cord is the dorsal root ganglion, which is releasing neuropeptides like substance P and CGRP, which will cause sensitization. This sensitization can lead to allodynia, hyperalgesia, and it can also lead to increase in the receptive field of pain. Yes? We also know that these neuropeptides can be released antidromically. The reason this is so important is because this will cause the trigger point to become more painful. How do we know neurogenic inflammation is occurring and active myofascial pain? Because we see elevated levels of these neuropeptides. So now, not only will this muscle be affected, latissimus dorsi, but so will any muscle innervated by C6 to C8. So this will affect the myotome. So for example, the extensor forearm muscles, the triceps muscle, all these muscles can potentially become painful and tender. That's because the patient is sensitized from C6 to C8 in a chronic myofascial pain. We also know the skin can be affected, such as the dermatome. And we know that there are sclerotomal structures, such as the periosteum, the ligaments, the tendons, and bursa, yes? So if you have a patient who develops pain in the elbow and they're diagnosed with bursitis or tendonitis, and they don't respond to local treatment, that means the problem this is not a local problem. This is a manifestation of segmental sensitization that could be caused from the trigger point. Yes? So we also know that there are changes in brain function, including neuroplastic changes in the central nervous system. And we know that there can be dysfunctional descending inhibition. So imagine if you have a patient who has both dysfunctional descending inhibition and persistent nociceptive bombardment into the dorsal horn. This is why these patients can now start to develop mirror image pain, dor hemispelo, right? And this is because of the spinal segmental sensitization. And we know the pain can spread up and down the spinal cord, activating other trigger points. So let's go back to our patient. Let's say you find an active trigger point and you do treatment. You can do treatment with needling, yes? Or, as we'll teach in the workshop, you can also use electrical stimulation to treat the trigger points. And if the trigger point goes away, then we can say this is the cause. It's the ovo, right? It's the cause. If the trigger point persists or it recurs, then we can say that it's la galiña, yes? And how will we know the patient is sensitized and that the pain is persisting? Because we can do a segmental examination, as you see here. So this is looking for signs of allodynia, pinch and roll, pinzado, rodado in Espanol. Sorry. Or we can use the pinwheel, yes, to check for hyperalgesia. And then once we find the segments that are affected, we can treat the segments with needling, injection, and electrical stimulation. Okay, there's a number of ways that we can do it. But what we want to see is what you see in the video, immediate decrease in the signs of sensitization, okay? As well as a subjective improvement in the patient's pain. And of course, we can check the muscles for trigger points, how tender the trigger points are, etc. And this is the structure that we are targeting, the medial branch of the posterior primary rami. So those of you who are interested in acupuncture also know that these are very important acupuncture points that correlate very well with these segmental points. So again, I want to thank Dr. Lucy for inviting me. It's so exciting to come. And thank you, Lucy.
Thank you, Dr. J. Pessoal,
Okay.
imagina, se o Dr. J fez essa aula, mini aula aqui para nós hoje, imagina no congresso. Nós aguardamos todos vocês e o doutor está preparado with his t-shirt. Show
I am
us.
so I am so prepared to come look at my wonderful jersey that I'm wearing. I have it on right now. So I'm ready to come to Brazil.
Wonderful. We'll
I'm
be,
ready. I'm ready.
we will waiting for you. See you soon.
Thank you. See you in 2 weeks, 3 weeks. Okay. Ciao.
Tchau, tchau.